नरसिम्हा रेड्डी जी का సార్ కెమెరా రిక్వెస్ట్ పంపించాను.
మధ్యలో కనెక్షన్ మార్చిన ఎందుకంటే ఇది అన్స్టేబుల్ ఉన్నది.
This conference will now be recorded.
ఫేస్బుక్ ఓకే. Welcome to Dr. TSPR show. This is Dr. Tangella Shivaprasad Reddy alias Dr. TSPR. Namaste. We have been doing many episodes on Corona right from February 2019 till the governments, right from union government to state government, doing many episodes on Corona right from February 2019. The executive or the administrators and their allied dash dash, they could not understand. That is the predicament. What if they understand the logistics? We have been bringing out various episodes, episode after episode, with very good profession. But still, I'm very sorry to say, people are panicking, running helter-skelter, not understanding what the pandemic is all about. So that is why we had to be precise and very clear in that regard. Today's live show, very clearly we wanted to discuss whether vaccination is the only saving grace for this corona. Introduce my guest before I just say few introductory words, then we'll straight away get into the discussion. Narasimha Reddy, Donti, he is public policy analyst. Once again, he has come out with a wonderful PPT which will make, at least it will be an eye-opener. And joining us, none other than Jaganath Chaterjee from Orissa, who has been pioneering patient advocacy and is also a health activist, and he knows the result of vaccination more than anyone else. So welcome to this special show, sir. I just give you a brief introduction. As a doctor by profession into journalism, let me make it very clear, we always believe in preventing a disease. So precautionousness is a precursor to preventive as well as curative measures. Whether that precaution has gone haywire, whether that precaution has become knowledgeable, or whether this precaution has landed every single citizen across the globe into fear psychosis mode to be exploited by the pharmacy, insurance, and the lack of apathy by the governments world over. Because even after 1 year sojourn from 2019 December, there is no improvement in public health care except for some states. From where I'm beaming it live, Kerala has been in the forefront. They're doing some good job. Likewise, to start with Rajasthan and after that Maharashtra too. But is it enough? Why there is no, we do not have a national policy on public health care? And World Health Organization is the biggest culprit. We have exposed how from Wuhan the virus was allowed to be exported to all others, and how WHO has come to live with that, and how it has malfunctioned. Instead of cautioning, protecting member country citizens from such a virus, it has allowed it to be exported to everywhere. They don't have any face-saving formula. Every now and then they issue confusing statements. Adding to that, the union government and the state governments, there is no proper response, because where is the data? We have been demanding right from the day one, if a patient is admitted into the hospital, on what is the basis you have admitted? What are the treatment protocols? Whether if he has discharged, we hope everyone recovers fast and joins their family. There will never be a loss of near and dear one of any family. Where is that case sheet? Where is the case sheet? In case if they have succumbed, unfortunately, did you do post-mortem? Or what are the treatment protocols? Has human body become a laboratory for drug trials? Is the doubt. And in that pursuit, vaccination also has become a tool, a method, none other than the software giants like Bill Gates and all. It is there very much, it has become viral how they have been going ahead. I do not understand what is vaccination and what is herd immunity. If a commoner or if Bill Gates doesn't understand, I'm very sorry to say that is why his country, Europe, they are again came back to lockdown modes. I appreciate those governments because they feel loss of life is intolerable. But here we have been pushed like herds. People have lost their precious lives, not knowing what's happening, from where it is coming, how it is coming. Because governments across the country, they have not bothered to include the pandemic in the public health care insurance or whatever it is. They have allowed people to be looted by private hospitals. Nothing against anyone, because Dr. TSPR show or channel is very clear in its strategy. No enmity towards an individual, nor animosity towards any party. Issue is dealt as per rule of law, constitution, invoking evidence act. So when such is the case, now India, whether we have herd immunity in the sense your body gains those antibodies to resist the invasion of a foreign enemy called now the so-called corona COVID-19. Is that the reason why people are going out? Is that the reason why governments are slowly coming back to normalcy? When that is the case, whether vaccination is going to be really helpful, and is vaccination the sole discretion of the health departments or governments all over the world? Just by vaccinating, you mean to say you can be out of these things? How does our immune system work? So, I will not waste much time. I'll make Dr. Narasimha Reddy Donti as presenter so that he can start presenting his PowerPoint presentation. Before that, Mr. Jaganath Chaterjee, you would like to add something before he gets ready? You can add.
Yes. You see, from the studies presented, we get a very strong feeling, and it is also reflected in the studies, that the viruses have not been isolated. Okay. They have taken an RNA, they have amplified it, and they have built a model around it, a computer model. And but there is the constant claim that a virus has been purified and isolated. Then if you see whether this virus is causing any disease, there are two studies that reflect that this is not affecting human cells. One is a Poland study, another is from US CDC, it was conducted by US CDC. It did not affect human cells. So here we have a situation where a virus has not been properly isolated as claimed, and if a synthetic version is prepared and introduced, it is not causing any harm to the human cells. Another thing is, the sequence they are presenting, we can have 100 microorganisms having the same sequence, and it matches 90 to 99 human chromosomes. So what are these tests picking up? There's a very strong question coming up now. What are they picking up? What are they saying? And if we see the Koch postulates about the microorganisms causing disease, the first thing is something has to be isolated, purified and isolated. It has not been done. Second thing is it must cause disease when introduced into a healthy person. It is not causing it. Third thing is it must a healthy person should not have that virus. But here we are having asymptomatic persons, people who are perfectly healthy with great viral loads, not showing any symptoms. And the fourth thing is again it must be isolated from a infected person. That also we know from a US CDC study that they have again used the same technology, the same modeling system when they have extracted a virus. So now we come to a situation where a great fear has been created without really a basis. And regarding the vaccines, what are they promising? They are saying it won't prevent infection, it won't prevent transmission, it won't prevent severe cases, it won't prevent death. I mean, these factors are totally overlooked. The trials do not reflect it. So then what are they, why are they bringing in this vaccine? And which has already in clinical trials, it has shown a number of adverse effects. The FDA has listed 21 adverse effects, and all of them are very serious and includes death. Already after implementation in the USA and UK, there have been a lot of anaphylactic reactions, acute allergic reactions. These reactions will not stop. They will consume the body like termites. And there have been deaths. A doctor has died. And according to this CDC reporting system, they stopped after recording 127 deaths. It is in their website. So we have to really raise questions now. And regarding the Covaxin trials, their phase 1 study is supposed to be completed March 21. They have not completed it. Their phase 2 study is supposed to be completed in December 21. And their phase 3 study, unfortunately, they have put a date November 21. Even before phase 2 is complete, they are going to complete their phase 3 study, and it has not been taken up yet. And there is a case of, volunteers. In the first phase, they took 1125 volunteers. Next, it suddenly dropped to 124. What happened to the others? Why did they drop out? And this has been, it has been approved without any regard to efficacy. Efficacy data is not there. So if there is no efficacy data, how do you approve a vaccine? So there are a lot of questions. And, I think today's topic is very relevant, that the vaccination will increase the problem. It is not going to solve anything. And that they themselves are telling, the authorities are telling, even if there is a vaccine, you have to continue wearing masks, you have to continue sanitizing your hands, you have to continue, social distancing, and maybe we have to continue lockdowns as well. So what are these vaccines achieving? It is a great question.
Yeah, I'll come back to you again. Let me go back to Mr. Narasimha Reddy, Dr. D.Narasimha Reddy garu. Sir, is vaccine alone the cure? You mean to say just take vaccine and just go around so that you stay safe and healthy?
Yeah, that's a question before us. Dr. Jaganath Chaterjee has brought out many issues related to vaccines and vaccination. But I think we'll go beyond. Does corona pandemic, the answer to corona pandemic lies only in vaccination? I think that's a question we need to put ourselves, and also we need to explore whether that's the answer. So I think I'll share some of my thoughts on that, and then we'll have a discussion if at all. This is my okay. Just to look at the clinical and non-clinical responses when corona pandemic was announced in January 2020. In fact, WHO announced it as a global pandemic. That was almost 1 year back. Even though the problem started much earlier in China, I think somewhere around November, and December we read a lot of reports, and then January, February was very intensive discussion whether it has to be declared as a global pandemic. Anyway, if you look at the entire 1 year or more than 1 year process, if you look at the responses, one, we have been told that we need to do hand washing, regularly. Then you have to wear mask, and you need to maintain physical distance between each person, 2 meters, 6 meters. There was a variation in that distance, and then gradually when the problem increased, I think patients started getting a treatment of antiviral drugs. So there was again discussion on which are the best drugs. So you have remdesivir, flavipiravir, and many other drugs were promoted. Of course, hydrocyclo, HCl, which was used for anti-malaria drug. Uh, so I think there was a lot of discussion whether they'll work or not. But anyway, we all pushed with those drugs. Even now, I think those are the drugs which are being used in treating the COVID-19 patients. Then there were a lot of discussion on ventilator support because oxygen supply was decreasing because of COVID-19, corona is affecting the lungs, and the ability of the lungs to pump in oxygen has gone down because of corona. So I think again we had a lot of discussions and scary, scenarios were painted where hospitals have very less ventilator support, and but then there are more patients coming in. So then we were given how to at home you can have your own ventilator support by oxygen cylinder. So patients, and I think the globally humanity has been pushed towards some of these solutions. And then I think eventually the discussion picked up on vaccination. So vaccines are being developed, and someone said it will take 18 months, 20 months, 7 years. Experts said 5 years, 6 years. Then they said no, we'll reduce it, and now that's another discussion holding. On the other side, you can look at government responses all over the world. So they responded with a lockdown, very late lockdown, complete lockdown. In fact, Oxford, there is an Oxford group which is tracking the government responses, and they said how intensive government responses has been. If you look at that data, I think the response from India was much severe than China. China ranks somewhere around the points, 56 points, and Indian response was 81 points. So that means that drastic measures were taken by the government. People thought China was doing it more, but looking at this tracker, we can understand that democratic countries have taken much more severe measures against their population. And then we had testing, now again, tests have been, rapid antigen tests, RT-PCR tests, and then the actual, the whole discussion on testing and the efficacy of testing to, correctly map whether a person has been infected. I think even that discussion is still going on, and I'm sure Dr. Jaganath Chaterjee can help us in understanding whether these tests even today, how efficient they are in declaring positive or negative cases. And of course, asymptomatic cases are something different discussion. Contact tracing was a lot of contact tracing was drilled into our minds. I said we need to trace whom with whom you interacted, all those things, and now that is abandoned. Isolation has been recommended as a solution for long. Even now, they're saying isolation is a pollution as well, then so mostly, government responses have been looking towards anti-social behavior. So they don't want social interactions to happen. So I would put them as anti-social responses from the government. And of course, we have been promised that after some 30 days, 60 days, you will have herd immunity. Even this concept, I find it very crude because what they're saying is, if some percentage of population gets infected and they come out of it, eventually that creates a herd immunity. I think this is again a concept or a perspective, but actual medical solution is something else they want to push through. Now, I think there have been system responses. As I said, there have been system responses, government responses, individual organizations responded. So they said you can work from home, and government said no, you sit at home. So many of the people, daily wage workers, had to respond differently because they required income, they required food. So, but system responses still got more, acceptability. And if you look at community responses, which have been very few and far between across the world, communities also responded, which are much more democratic responses. And then the individual responses, we could see many of them were in a panic, and many had to forego a lot of things. If you look at the women at home, I think they were burdened a lot whenever this lockdown was there. So these individual responses are something which have been mapped much more. But I think we'll look at only systemic responses here and discuss what are the problems there. Now, globally, I think a lot of disruption has happened because of lockdown created by Corona. The economic spiral down because even before Corona, I think by June, July, August, I think economy was slowing down, and there were indicators that a lot of the countries were going into recession. So if you look at US economy, I think it was already in trouble before Corona pandemic. But once the pandemic was declared and the lockdown was announced, I think economic adjustments came to highlight. So people started looking at how to, bring about changes in the economy, basically production, consumption, trade. I think all these required a lot of adjustments. But then there was no cooperation between the countries. So even though WTO, World Trade Organization, is there, I don't think WTO has ever discussed Corona and how to, make changes within the trade. Because free trade, which is supposed to be there, suddenly became nationalistic trade. So countries started responding by storing food grains, stopping trade, or protecting their domestic production sector. So we can see overall there is lack of multilateral cooperation. Even now, after 1.5 years, the WHO remains, a fragmented organization which is unable to bring together all the countries to sit and discuss on how to bring about a unified response system. On the other hand, if you look at the United Nations and World Trade Organization, so you can see that they have been nowhere in the picture. So I think this has not yet happened, but that should have happened, and that's the way out because when we are saying Corona is now has started somewhere and it has spread across the world. Almost all the countries are affected directly or indirectly. So the global responses have been very, narrow, short, and very unpragmatic, you can say. Supply chains have been disrupted. So we have seen supply chains of food or even goods like textiles, which are linked from European countries. All of them have been disrupted, and so this economic spiral, downward spiral, I think that has affected a lot of the population. But even today, I don't see any efforts to, cooperative efforts to respond to that situation. Now, the biggest thing is, whenever a virus has come about, if you look at previous episodes of virus or pandemics, before Ebola, before malaria, cholera, whatever it is, I think there have been efforts to trace where it has come from, and there were efforts to control that at the source. Now, with regard to SARS-CoV-2, what we are talking of new novel coronavirus, the discussion is completely absent. So even though some efforts we could see, some committees have been established to source, establish where this has come about. But I think even today those efforts are very low or not seen. I think they are insincere efforts about that. One, people have been saying it has come from lab. So Wuhan lab, Institute of Virology in Wuhan, I think that's a source which is being pointed out by many scientists. But then people who are involved in that research, they are saying no, it is not from that, but they are trying to blame the linkage between animals and human linkage. So that's where zoonotic linkage has been pointed out. There are other researchers which are saying this is because of climate change. So as the global climate is increasing, it has led to a lot of humid conditions, which increases the bacterial and viral spread all over the world. So I think climate change has also been pointed out as one of the, if not the source, at least creating those conducive conditions for a virus to, thrive and spread across the global, across the globe. The ecological imbalance, again, there have been research which said when forests have been removed, deforestation, biological diversity has been lost, ecological diversity has been lost. The viruses, bacteria, which were living in those diverse, ecologically diverse ecosystems have now come out. So now we are being told that increasingly we are going to face more and more bacterial and virus episodes all over the world because of that. And I think even recently, if you look at data coming from Arctic and Antarctic areas, even Siberia, they said bacteria which was lying there, now we can see it coming out because of glacier melting and all those pink or green kind of algae or bacteria we can see, and viruses are also coming out is some of the research is saying. So overall, one is SARS-CoV-2 is still, I think, under investigation, but not no government is looking at where it has come from and how it has come from. I think that's the biggest silence. The silence of all the governments on this shows that they all know where it has come from, and the literature increasingly points out to a lab as a source. Now there are many labs, even which are continuing with the research on viruses, especially gain of function research. So they are trying to, change the function of the viruses and gain out of it. But then SARS-CoV-2 is also pointed out as one of the results of gain of function research. That means the functionality of viruses, which were not airborne earlier, now they have become airborne. So many of those functions have been altered. That's where lab is being pointed out. Now, globally, there is no effort which we can look at, responsive to these kind of sources. So even if we discount labs, but still we have labs. So that we can we'll discuss further. But then the global response on all these four factors is still very muted. Now, Corona has become a ruse, rather than the cause. It has increasingly become a ruse. It has become wajah. It is to change some of these current, economic and political dimensions of different countries. So we are increasingly seeing democracy in danger. So when the Epidemics Disease Act is applied, very, just a four-section Epidemic Diseases Act was applied. At that time, people thought, okay, we did not have time. But now, 1 year down the line, government, trying to bring about a more democratic disease regulation system. So they are continuing with the same Epidemic Diseases Act, which is draconian in nature, and trying to apply many of the conditions which they think is responsive. They are imposing on the citizens. So one is, you can see, publicly you should wear masks, otherwise you'll be fined or you'll be jailed. So that you can see. And then whenever there is lockdown, people daily wage income people, when they come out, police try to lathi charge. They did that, and even now we can see that kind of response from the government. So we are increasingly seeing democratic spaces being, shrinking, and the ruse is Corona. And you can see disempowerment is happening. Of course, a lot of deaths have happened not only because of Corona virus, because lack of other options, like closing down of hospitals meant people with the kidney ailments, people with they die at their homes without being getting any treatment, and then livelihood destruction we have seen. Uh, Hello,
Yeah, go ahead, sir.
Yes, please continue.
Go ahead, sir.
hello.
Yes, sir. Go ahead. Narasimha Reddy ji, we are hearing you.
Okay. No, I got this. Okay, fine. Sorry.
Yep.
So the livelihood destruction is one thing, and then there is a lot of displacement. So we have seen the biggest, I think, once in a century event where a large number of labor, daily wage labor move from say, urban mega cities to their homes, walking hundreds of kilometers just because the corona was imposed. I mean, lockdown was imposed because of corona. And then in the name of corona, we are seeing environment and ecological destruction. Most people thought during lockdown, because there is less vehicular movement and there is no production, factory production, pollution has decreased. Of course, it did decrease, maybe for 30 days or 40 days or 60 days, but for a limited period. But then, in the name of Corona, we are increasingly seeing deforestation has increased, ecological destruction has increased. So in many places we are seeing without public hearing, projects are being pushed through. So we are seeing that pendulum shift from lockdown, where some environmental conservation has happened, to extreme level of ecological destruction. So there are many examples, and increasingly we are seeing in India, Ministry of Environment openly giving license for drug production or chemical production, only by saying we need more drugs to respond. And we are saying India is going to be a global capital for pharma production, and pharma industries or companies are being given licenses to increase their production, expand their production without any environmental impact assessment, or going through the public hearing process which has been given by the Constitution. So there are many, even mining has increased over a period last 1.5 years across the globe. So this kind of destruction in the name of corona, and because of corona, people are government is trying to increase that. And if you look at urban areas where urban areas basically we call it a lonely crowd. So you have lakhs of people living, but with no interaction between them even before corona. And now that isolation has intensified. People are told that you do your work and come back to home and don't interact with your neighbors or within your community, because transmission can be controlled. So now you got that systemic support for that lonely crowd scenario in cities. And importantly, digital economy is being pushed using this corona. So you're saying sit at home, you can do banking, sit at home, you can work from home, sit at home, you can get your groceries. So this digital economy got the boost, and then the rules is again the corona pandemic. So increasingly we are seeing weakening of the public resources and strengthening of the corporate resources because of using this corona pandemic. So that's where questions are being raised about whether corona is a pandemic at all, and whether corona is so a dangerous virus. One second, it's not okay. So what we are seeing is power, whatever is power resting wherever, not only in India and within India across the states, but globally we are seeing power now being dominated by science. Now science is saying, this is the problem, and whatever they say, there are other scientists, but it is not questioned. And then business, science, and politics have become intertwined. So what Dr. Jaganath Chaterjee was talking about vaccination, I think we can see that naked intertwined interests of scientists, business, and politicians. So together, I think these people are increasing their wealth. So in the last 1 year, 1.5 year, we have seen the wealth of one person has tripled or quadrupled in the last 1 year, despite economy tanking, despite loss of livelihood, despite unemployment increasing. But still, the wealth of this 1% or 10% or 20% of the people increasing,
Mukesh Ambani,
and
Adani,
that's where because of power. Sorry.
Mukesh Ambani, Adani, even our
Ah,
executive also was about to celebrate, and when public reacted, they went back during Corona time.
yeah.
Yes.
So we have our Deshi millionaires becoming billionaires and billionaires becoming, global
Entry.
wealthy persons.
Forbes list.
And if globally we can see Amazon, Jeff Bezos, and Bill Gates, all of these people have increased their wealth despite Corona, despite pandemic, despite lockdown.
That too, when
Now, what we can see is
common man is
what will
suffering.
continue.
When
No,
when common man is suffering, please.
yes,
When common man is suffering,
common,
and people like us, we cannot generate money from anywhere. While this 1% across the
because,
globe, they have become, they have entered Forbes
uh,
list mysteriously. Yes, sir. Go ahead.
because we are disempowered. That's what I know. This says the power becoming concentrated, democracy space building, and that perpetuation and intensification of power in the name of corona we can see. So what we can see is on one side, mutation of corona is happening. So now we are looking at the third strain, and maybe we don't know how many strains are going to come. Second, more viruses are likely to come out of the labs. So if you look at the literature, many more viruses are being researched even now, and whether they will be used as a bioweapon or whether they will be used as an economic weapon, we don't know. But still, we can see that. And then zoonotic viruses, of course, they are there, where big animal factories, piggery, or we are looking at beef industry or poultry industry. So we are seeing you increasing the zoonotic viruses coming back. And recently now, the last 3 4 days, we are seeing ducks
Kerala.
getting affected by virus in Kerala and Rajasthan, Madhya Pradesh. I think there are 4 5 states there the avian influenza has come back. And even before that, we have seen strange viruses or bacterial infections in livestock in Andhra Pradesh and many other places. So increasingly, we are seeing this, amalgamated viruses coming out of either animals to humans or humans to animals. So this interaction is continuing, and that's because of our food systems. Now, climate change, of course, increasingly we are moving towards 2 degrees centigrade. So that means, the disasters. We are seeing floods. We are seeing floods increasing. We are seeing looking at more and more flooding in low-lying areas like Philippines. I think suddenly they got storms continuously happening, and many other places. I think severe cyclonic storms have been recorded in this last 1 year. So we are increasingly seeing climate change disasters increasing, and livelihood crisis because of all this, one after the other crisis hitting the population. So people are dying, and then this economic downturn has led to a lot of debts, and debt-related debts are also increasing across the country. Even food systems, which are supposed to be diverse, have become monolithic, and they have become more, contaminated food systems. I think that is increasing. So overall, what we are seeing is that immunity is under constant threat. Now, ironically, every expert on corona and viruses, they say your immune system should be strengthened. But if your immune system should be strengthened, the answer, is not vaccination.
Yes. Go ahead, sir.
Answer lies in food systems. Answer lies in economic systems. Answer lies in the so that apart, we are being given, even though these are the crises, we are the solution which is being pushed is vaccination.
How true is that, sir?
So virus labs will continue. They are going to get more funds out of this because funds are being routed from governments to these private companies to this virus labs, and in the name of vaccination, as if that's a solution. So increasingly, we are seeing that global business and virus science getting amalgamated or intertwined together, and increasingly political power. They think pushing vaccination will help them in staying in power. So even in democracies like America or India or many other places, vaccination as a solution enables people to stay in power. And ultimately, digital economy boom is being pushed across the world by the people like World Bank or even Bill and Melinda Gates Foundation, Bill Gates, Amazon. So all these people are pushing, and politicians across the world, in India, in states like Telangana, everywhere they are picking up as if digital economy is the answer. So vaccination, whenever we are seeing vaccination as a solution, we need to look at the entire scenario behind vaccination that is pushing for that vaccination. That we need to understand clearly. Now, if you look at this simplistic, slide, the drugs will push down the immunity, and the food will increase immunity. So, the global economy is being built around drugs and vaccines, but no one is talking about food systems and how food access can be increased. So, if you look at India now, the current agitation by the farmers, where they're fighting against the three laws which were brought about by the Indian government recently. This is a discussion about food. Increasingly, in the last 5 years, we have seen many foods have been lost. Access, people, at least if you can look at 30, 40 crore population living in rural areas, their access to diversity of food is lost. So increasingly, prices of food has increased. In the last 1 year, you can see prices of pulses have doubled. So it was 70 or 80 rupees. Now it has come to 180 rupees. So the protein which can come from pulses is now not available for poor people, rural area people, and people who landless people. So increasingly, food which is the answer for for people to protect themselves from these viruses and increase their immunity. I think that is being under threat. And on the other hand, drugs are being pushed, and drugs as a solution is being pushed. So I think we need to look at this dichotomy which is emerging in India and elsewhere, and we need to question this the process. So I would say what kind of antivirus measures are required. We require a severe change in the economy. The economy, the production, relations of production have to change so that more employment can come out of this economy rather than automation, mechanized kind of production. And then we need to reduce all those activities which are like, leading to environmental degradation and ecological destruction. I think we need to have a drastic reduction on that. So increasing, vehicles, we need to decrease on vehicles. But ironically, in the last 6 months, we have seen liquor industry getting back on tracks. We are seeing vehicle industry getting back on tracks, but not economic systems like public transport systems and ecological production. So we are seeing increasingly seeing antivirus measures which are required are going back, but coming to the fore are environmental destruction activities. Food production systems have to be diversified. So we cannot depend only on rice and wheat. We need more pulses. We need millet production. We need local production systems where food can be distributed at a more accessible level for poor people. But increasingly, we are seeing these three laws and other measures by the government, which only increases the distance between the poor people and the immunity they can get through this food. So just examples are, dry fruits. We are seeing in the last 1 year, only middle class and upper middle class people are buying dry fruits to increase their immune system. But then that means the cost has gone up, prices have gone up, pulses prices have gone up. Many other products which we think will improve the immunity have become expensive. So many families are not able to access them, and now they are pushed towards only vaccination. So we need agroecological systems where food availability can increase at a rural level. I think that we need to push for. And we need democracy to be deepened at a global level, at national level, and also at the village level. But increasingly, we are looking at a reverse. Hello.
Yeah, go ahead, sir.
Yes, yes.
So the point, no, my point is simple. We, governments, business, and the current, ruling elite, I think they are pushing for vaccination on as the solution because they are bringing a lot more measures, related measures to vaccination, only to hold on to the power, hold on to the wealth, hold on to their sovereignty, and decreasing people's sovereignty, decreasing food sovereignty, decreasing the freedom of the people, and decreasing the democratic spaces, shrinking our spaces. So I think we need to discuss this more and more so that people can come up with solutions which are not monolithic or monopolized by vaccine industry or pharma industry. I think that kind of discussion has to be enabled, and I hope these thoughts will help in increasing the debate on those kind of responses. Thank you, Dr. Shiva Prasad Reddy, for giving me this opportunity.
Wonderful, Dr. Narasimha Reddy Donti. Again, you have done an excellent job. Excellent job. You have really, really hit the bullseye. Let me be very clear and frank with you. Bullseye. Let me be very clear and frank with you. You have hit the bullseye, and now I think the people have been watching across the globe, not just India, but across the globe. What is happening in the name of vaccination? It has been very clearly dealt with evidences. It has been exposed how people are being imposed in. I think you can give back me that the presenter this thing, sir, if you can just
Okay.
so that we can have a discussion of 10 to 15 minutes before we close, so that I can rope in Mr. Jaganath Chaterjee also.
Okay.
Yeah. It was wonderful presentation, and you have exposed how in the name of vaccination the wealth is being increased, or rather wealth is being cornered only by a selective few, creating fear psychosis, killing the democratic spirit, not allowing people to venture out in the name of corona pandemic fear. But gentlemen, let me bring an example to you. How can this be a diversified event? Bihar elections, masses participated, including Prime Minister of India. We have seen local body elections, 3-tier in Kerala, Telangana, other states. And now even we are watching farmers opposing the 3 amended laws, sitting in protest in Delhi in thousands. No one is getting affected, no one is getting killed because of corona. And if elections could be held, why there is need for vaccination, Mr. Jaganath Chaterjee?
Yes. Donti sir, thank you for an excellent presentation, for a holistic presentation. Now the threat clearly is vaccination. You see, this vaccination, unless this trust on vaccination stops, we are not going to get back our health. And the only thing to stop this is to question the basics behind vaccination. We have to question the germ and virus theory itself. Because this germ and virus theory is veering the attention away from health, from the ecological foundation of health, from the need for good diversified food systems, the need for a conducive climate and environment, and the political forces are using these theories to undermine our systems and make us sick. And in the process, the pharmaceutical industry is prospering. All those economies that depend upon the destruction of health and environment are prospering. So what is this German virus theory? When it was proposed first by Pasteur, it was vehemently opposed. There is the famous Beckham versus Pasteur confrontation. Dr. Antoine Beckham, who was an MD, he told that a waste heap attracts the flies. The flies or mosquitoes do not cause the waste heap. What he meant was that these pathogens become active only when the body is sick. They don't make the body sick. Now that is a perfectly valid explanation. In fact, these pathogens, as we have seen in a number of studies, they are the basis of good health and they are the foot soldiers of health. When the body becomes toxic, the body accumulates waste matter, then these pathogens, they become active to detoxify and get rid of that waste matter. What happens in case of a flu? When the lymphatic system becomes sluggish, then waste matter accumulates within the system because the lymphatic system is responsible for cleaning the body, whereas the circulatory system provides nutrients to the entire body. The lymphatic system is the drainage system. It collects all the waste matter from the body and it eliminates them. So here we have a system where the foot soldiers of health are being killed and more toxicity is being induced in the body. Now this virus theory, it became active after polio came into the scene. Now polio is, in essence, it was caused by spraying of DDT in agricultural fields and it's used as a home disinfectant. But DDT was owned by Monsanto and Monsanto did not like the prospect of withdrawing its profitable product. So a charity called the March of Dimes, it gave money to the scientific establishment to try and find out a virus that was behind polio. They did find out a virus, they located a virus, but when they injected it into monkeys, the monkeys did not become paralyzed. So what they did was they sawed open the brain of the monkeys, the skull of the monkeys. They injected this mixture into the brains of the monkeys and the monkeys became sick. So that became the basis of the theory that the polio virus causes polio. And then the virus itself started causing polio because it was again, it was a toxic matter being put into people and the body responded. But slowly this virus theory, it started fading. And all the virologists, they started feeling threatened. So when the AIDS disease came again, and they said there is a virus called HIV which causes AIDS, then everything, it looked up again, things became better, and all the virologists became AIDS specialists. They all got their livelihoods back. Tremendous amount of money was poured into the pharmaceutical industry. But till date, we don't have that one definitive study which proves that HIV causes AIDS. And there is no vaccine even. And it came out that the smallpox vaccine, a WHO consultant, he did a study and he declared that the smallpox vaccine was behind AIDS. Then there was another Kaprowski polio vaccine being tried. It was an experimental vaccine, and that too caused AIDS. And then again the hepatitis B vaccine, nobody took it, so they pushed it into the homosexual populations and they developed AIDS. So all these became, a fundamental theory, instead of an assumption, it became a valid theory that something is causing AIDS. So this gets more interesting when, Pasteur, he used to keep a diary. He noted everything there very truthfully, because Christians, whatever they do, they try to be truthful to their soul, so that at the time of their death they can confess and escape the wrath of God. So after he had strict instructions. My diary should not be published under any circumstances. But after his death, somehow, along with his other belongings, that diary was also, it went to a museum, and subsequently it was noted by researchers. The researchers researching into Pasteur's belongings, and they found that diary and they were shocked by the revelations there. In fact, Pasteur, who is behind the germ theory, the rabies virus and all, he has written in his diary that to prove that germs cause disease, he used to, in the virus and all, he has written in his diary, produce those germs into the body along with a mixture of, mercury and arsenic to make those people sick. Now this is a tremendous, it was a tremendous, it was a tremendous thing that he lied to such an extent. And after that, after these revelations, no one is talking about that diary, because people don't know what else is contained in it. And Pasteur was known, he was, in his lifetime, he was known to be manipulative. So here we have the basis of medicine, the assumptions have been proven to be wrong. I was mentioning the Koch postulates. Koch himself, he derived those postulates, and he was very sure, pathogens would beat those tests. But he himself, he confessed that no pathogen, either germ or virus, could fulfill the Koch postulates. And after that came Thomas Rivers. He tried to have another more compromised criteria for pathogens, but he also failed. And we have a system which does not meet those criteria behind the vaccination thing. And vaccinations, I don't know how vaccinations can improve immunity, because it causes the immune imbalance. It causes autoimmune disorders. Through its toxins, it severely hampers the body. And so I am very fearful, that what this mass vaccination of 7.8 billion people is going to do. You see, we have theories about infectious diseases, highly infectious diseases. For example, Ebola. They said, Ebola is spreading in Africa. But when journalists went and questioned those people, in those regions where Ebola is manifest, the people said, before this epidemic, they came and injected us with something. So this virus theory, that a lifeless, invisible piece of thing is moving at the speed of light and killing people, affecting people, it has to be questioned. Now the time has come. Dr. Thomas Cohen, he is an MD. He has written a book called The Contagion Myth. He has said that we have before us all sort of factors that are causing health problems, but we are running after germ and viruses. If you read that book. It is a tremendously well documented book with all proof where he proves that changes in food system, as Don Tisar is telling, and other factors, the other factors like he also points out that the prevalence of radio waves, of electromagnetic waves, and the current threat of wireless communication, 5G. These are great threats. So what is the combination going to do? We are having now, in the name of bio-fortified, fortified foods, we are going to have GMOs, and GMOs will bring herbicides with them. We are going to have these vaccines and all these protocols. You see, this theory of a lab virus, suddenly coming out, I believe it was done to create fear and to justify the treatment system. The protocol that is in force for treating corona is highly destructive. You see, now we have instances of fungal infections coming out in coronavirus patients after recovering from corona. Our doctors have said this is because of the use of steroids. If you use steroids, then we will have fungal infection. And also, we know that the government itself is warning against antivirals like remdesivir, the use of plasma therapy in corona, and we still have that anomaly where only people who are getting treated in hospitals are falling, they are dying. There are very few, I personally don't know any death that has occurred out of a hospital. And I have friends, who are calling me up and they're saying, we got out of the hospital, but we are very sick. I told them, why did you get entry into the hospital? They said, see, we are diabetics. And we are told that in case of diabetics, corona can be very severe. So we have this fear thing, everything. Fear sells drugs, and drugs are not going to improve our health. I salute Don Tisar for pointing out all the factors that should be taken care of, all the factors that we should keep in mind to escape this situation. And I don't know how we are going to convince people who are fed with all these things in the name of science, how we are going to counter the pharmaceutical industry, the very powerful vaccination industry, how we are going to counter these people like Bill Gates, Klaus Schwab, and this organization called World Economic Forum, which has emerged from nowhere to take control over the world. So we have a daunting task, but we should keep on fighting. We should keep on revealing the truth, so that because we should know that as a society, only if the whole society is healthy, that we can function and we can stay healthy. Thank you.
Wonderful. D.Narasimha Reddy garu, your closing remarks. Lakhs have participated in the elections, but attended by none other than our Prime Minister of India. Bihar and even Kerala, Telangana, we have seen. Now even we are watching lakhs, thousands of farmers staging sit-in protest in Delhi. Because they come from rural areas, as you rightly pointed out, diversified eating habits, healthy eating habits, and healthy life. Is it a precursor to that immunity? When such a immunity is prevailing, when government is planning to reopen everything stage by stage, how does this vaccine hold its merit? And that too, Covaxin or what vaccine? We have not seen stage 1, stage 2, stage 3 trials. Nothing is being shared. There is no data. Even ICMR, I've been writing mails to everyone. Where is the data? They are not releasing the data. Whether it is this biotech, that biotech, now Swadeshi has come straight into the fore. While 100% FDI, foreign direct investment has gone into retail, now we talk about vaccines, Swadeshi. D.Narasimha Reddy, you wind up, sir. You wind up, sir. Donti garu, meeke. You unmute and finish it. Unmute, sir, unmute.
Please unmute.
Thank you. I'll use this occasion to add a few more aspects and then give a conclusion.
Yep.
One, I think there is a similar behavior across the world
Hmm.
of people who are already in power
Hmm.
and the way they are responding to or using corona pandemic to
Hmm.
continue to hold on to the power they are having. So whether it could be business, whether it could be scientists, or whether it could be politicians, we can see that similar behavior across the world. There are, of course, some democratic way of dealing with that pandemic. You can see what's happening
Hmm.
in England or some steps in Australia, and of course some places in UK or even in America. So that apart, I think there is a similar uniform monopolistic behavior. I think that we need to understand. Secondly, in this behavior, what you have pointed out is what the people in power do and what they expect from the common people is quite diverse. So they expect the people to, wear masks every time they go out, and they expect the people to stay at home. But then the same power, they go out without masks. So we have seen Trump, or even his vice president going out as if they are not covered by the law, the very same law they are using. We have seen in India also political parties and even politicians, chief ministers, and prime minister himself sometimes not following what they expected from the people. So we can see the difference, and they have a justification. They say we can do, and we will not be affected, and they want common people to follow those imposed rules. And then media, and I think the role of media in this, is a flux. So we can see media, a lot of the media is in trouble. So individual journalists are in trouble, so they are not able to push through independent stories. But then we have paid media which is trying to push this argument or the entire paradigm of vaccination. So they are pushing through many ways and trying to create a fear psychosis that we have seen. But then, even then, they could not mask the labor walking for hundreds of kilometers. The mass exodus, they could not mask that. They had to show that. So we could see these responses coming from the people because they no longer want to follow whatever powers are imposing on them. So I think that resistance we can see here and there, but then increasingly we are seeing vaccine. I think that we need to question. I think what Dr. Jaganath Chaterjee said and what we are seeing recently when approval has been given for both vaccines without following procedures, and there is no answer from the regulators. We are seeing company bosses coming up with responses, but so far we have not seen a regulator answering the questions which have been raised by themselves. Competitors have raised a question about the other competitors, but then there is no answer. And now I think today the news is both the competitors have come together and they said we'll bury the hatchet and we'll continue our businesses. So in collaboration. So again, this is the indicator that how collaboration increasingly is happening at a conspiracy level. Conspiratorial collaboration is clearly seen recently and in many other episodes as well. So I think we need to increasingly to question that and try to open up the democratic space which are shrinking. I think social media is one promise and hope where we can continue to have these discussions. And I think increasingly we have to ask for food systems which are democratic, diverse, and ecologically sustainable. I think if we push for that, I think all other systems will collapse. I mean, the systems which are being imposed, I think they are going to collapse. So we have to focus on food systems and democratize the food systems and increase food sovereignty where people can produce their own food and they can increase their own immunity and they can increase their own skills and increase their own knowledge systems. I think that kind of resistance we need to support. And I hope this kind of discussion will help in building that kind of resistance. So thank
Wonderful.
you.
Wonderful, wonderful. It will build Narasimha Reddy garu, because you have presented so scientifically and logically. It is the food system that has to be diversified and more so in a democratic way, so that the natural immunity happens from the food systems, from the foods which we eat. It's an example that so many farmers, though they lost their lives because of various other things, because of heart attacks, because of the cold waves, the farmers who have sit in, and again the Bihar elections, even the elections in America, elections in Kerala, Telangana, everywhere, they have not shown people dying because of corona, in spite of not maintaining any physical distancing norms. Nor I have seen Mr. KTR, who himself advocates in person, he tries to have mask. In one of the interviews, there was no mask. When he was addressing such mass gatherings, people were very so close. How well they have been sanitized? He has to answer. Right from Bihar elections to Kerala. When such is the case, then why the hell daily this fear psychosis being set in? And we have received some questions. They say whether these vaccines are being used in the name of fear psychosis as testing tools, third stage or fourth stage. They have been, and Bharat Biotech has no data, and the Covishield, the US, Britain, London one, Oxford one, whether it is trying to utilize our innocent Indians who have been now roped in into fear psychosis. They have now, there is a clear division in the political affiliations lines of people. Your comment, and then I'll go to Jaganath Chaterjee and wind it up.
Yeah, I think the question is about the data efficacy. I think it was already touched upon, but if you look at what is happening with the vaccination approval, vaccine experts themselves, we don't believe vaccines are the answer, but vaccine experts themselves say the entire process will easily used to take 7 to 8 years. Now, but then we have reduced it to 7 to 8 months. So far there is no scientifically justifiable, rational explanation on how they did reduce this time gap, of approval process from 8 years or 12 years to a mere 6 months. So I think we have to ask these scientists, basically scientists. I'm not concerned about these pharma companies or the business. I am asking the scientists, why don't you come out and help people understand how this process has been reduced, and how can we trust this reduced process for its efficacy or integrity. So, so far, I don't think any of the doctor associations, doctors, medical doctors, without knowledge on virus or virology, are now prescribing vaccination as the answer. So let them, let these doctors, let this Indian Medical Association, all the other medical doctor associations help us in understand how this reduction in the approval process has, has, has kept the integrity of the entire process intact? I think that we need answer. So it's not about numbers. Today they'll tell you we have done trials with 26,000. Tomorrow they'll tell you 50,000. That I don't think we can trust, because unless you have this comprehensive rationalization coming from themselves. Now, second, I think the recent episode of vaccine experts again questioning one vaccine, co-vaccine. So the regulator, it seems, I have not seen the regulatory approval letter, but the one expert said it says clinical trial mode. So again, it was said either you have a clinical trial or no, or you have gone beyond clinical trial. And what is this clinical trial mode, where you vaccinate lakhs of people using public funds? You see, I think this controversy has come about only because public funds are there is a competition for public funds. So when Government of India announces universal vaccination, it means our funds, public funds, government, very scarce funds, because now Government of India does not have funds for many other things, for welfare and safety. Scarce public funds are now being channelized for you in the name of universal vaccination, and these funds are going to these two companies or three companies. So there the regulator has the answer. So we need an Indian Parliament to sit, and when we are saying 3 crore population is going to be vaccinated, our entire Indian population is going to be vaccinated, I think this is the decision which has to be taken by Indian Parliament based on discussion. So why Parliament is not in session? You vaccinate all the MPs and then let them sit and discuss 745. Vaccinating 745 is not a big issue. Let them take that vaccine and sit and discuss and say whether we can vaccinate the entire population, whether we can use public funds, whether you can use the entire public health infrastructure to focus only on vaccination. I think these kind of responses are required, and we need to ask. If not, the government executive, I think Supreme Court has to give us the answer as well. So all the four constitution pillars of Indian Constitution, they have to answer these questions and help the common people understand whether vaccination is required at all, and whether only vaccination is the answer, and whether we have other answers to increase our immune system, and what are the steps we are being taken. Now budget is coming up. Union budget will be announced in January 31st or 1st of February.
1st of February.
I think allocation are going to decide the way government is going to take the direction.
Yep. Yeah, in between.
And
We lost your voice.
maybe
Narasimha, we lost your voice in between. This is another way of trying to put us. It's long. Narasimha Reddy garu, I think the voice. I'll come back to you again. The voice is not clear. Jaganath Chaterjee. Yeah, Jaganath Chaterjee.
I think
Yes.
this will set
You see,
the public policy direction.
We emphasize
Narasimha Reddy ji, your voice is broken.
what but
I'll come back to you.
yeah.
Yeah, Jaganath Chaterjee, go ahead.
Sorry. Okay.
Of the medical profession on the vaccines can be caused by the fact that 60% of doctors and nurses in the USA are refusing to take it. Now they are being given an incentive of $500 in some states of the country to take the vaccine. And in India, though the government doctors they have been registered, the private doctors are resisting registration. So the doctors themselves are not willing to take the vaccine, and this has been observed earlier also. In hospital settings, the flu and hepatitis vaccines, etc., they are almost mandatory. But very few doctors take them. So adverse effects are real, and in this current scenario, when the vaccines are promising that they won't work, they won't stop infection, they won't stop transmission, they won't stop severe disease, hospitalization, and death, then what are they there for? And if they are not going to stop infection and transmission, then how are they going to create herd immunity? So these questions have to be asked. So this is a completely meaningless exercise if we consider all these things, and they are telling we have to continue with all these things, masks, hand washing with sanitizers, staying at home, social distancing, and these are immune breaking measures. You see, vitamin D is very essential to avoid this kind of epidemics. We are staying at home. Washing hands with the chemicals will disrupt the microbial composition in our hands. If we wear masks, we are deprived of oxygen, and if we avoid socializing, our immune system becomes depressed. So we are being told to destroy our immune system and become more susceptible, so that we can have more diseases in the future, so that they can sell more drugs and more vaccines. And this is a never-ending cycle. We have to break it at one point, and the only thing is refusing the vaccines and the measures being suggested. Thank you.
Wonderful, wonderful, wonderful. Let me close now. I think it has been very clear, as Narasimha Reddy garu has pointed out. The wealth is getting into only 2 or 3 companies, and that to our public fund, without any discussion in the parliament. How can a government take such a decisive decision of immunizing and vaccinating India? They have to answer, whether it is Bharat Biotech or the auxiliary angle of Oxford vaccine. What is the data of stage 1, stage 2, stage 3? They have to safety, efficacy, and then what are the clinical trials? What is that they found out before they really go for 4th stage? The data should be made available to the people of India. Not only India, world at large, wherever this vaccination process is in the offing. Because health is wealth. It is the health of people. And Indians should clearly understand that we, the Indians, have dedicated our constitution to ourselves. We are on our own. Ourselves is a constitutional authority wherein Prime Minister to Chief Minister, Union Cabinet Secretary to Chief Secretary, they are paid by our taxes, they are in our service. So remove that fear psychosis. Draconian laws will not affect, as rightly pointed out by D.Narasimha Reddy garu. The 4 pillars of democracy, now they have to answer. First let them get vaccinated. Why are you pushing it on to the common man? If that is the case, the elections which were held in Bihar, even the Panchayat Raj elections or by-elections which were held across India, what does it point to? How many cases you have detected? How many have been hospitalized because of corona, because of these elections? Come on, the data should be made known. How many people have died because of that? This physical distance norms were thrown to this thing, no sanitation measures. Still, you are trying to vaccinate in the fear that if you allow this to go on, people may become healthy at the end of the day. Once they come out of fear psychosis, sitting at home or trying to eat good food, diversified food. That is why our farmers are fighting there. Our governments have to answer, right from union to state governments. You want Swadeshi vaccine? then why is that you are not allowing the Swadeshi food, our farming community, foodstuffs they grow? Why are you trying to chemicalize everything? All those chemical related agriculture which farmers doesn't want to do. Where is Swadeshi there? Why is Swadeshi here? If you eat good food, don't you think our immunity can be boosted? If you remove that fear psychosis, don't you think people will live in a happy frame of mind? That will also boost. Don't you think if people are allowed to walk in the morning sun, vitamin D can be synthesized, through which vitamin C and all those necessary vitamins which are the basic of any immunity in a human will enlarge. So it is for the governments to come clean whether the public funds are going to be in the name of only 2 or 3 to make them more wealthier, as we have seen during Corona, India and across the globe, how the richer or wealthier have become the wealthiest, how the poorer have lost their jobs, they succor, how in the name of fear psychosis and health issue has become a law and order issue, political issue, economic issue, now what? Vaccination issue. It is for people to understand, come out of fear, start questioning, and if it is good, let us all accept it with folded arms, but there should be a science, a logic behind everything. And Swadeshi, when Swadeshi is not there for foreign direct investment, 100%, because of street side milk vendors and kirana shops, we have survived. Now that Swadeshi is going to go if 100% FDI is implemented in retail, but the same 100%, the Swadeshi slogan, how is that it is moving away from agriculture, which is our identity, which has saved us from this corona by boosting immune levels, by having diversified foods. That is why, is that the reason why before corona what was the rate of pulses, oils or onion? Now what are the rates of these essential commodities? Why are they skyrocketing? Is it not depriving people of basic necessary protein or vitamin rich diet which would help boost the immunity? Think over, kindly think over, better late than never. Otherwise people may, and people have to become informed, well informed, because it is health. Health is wealth. Thank you, gentlemen. Thanks a lot. Take care, sir.